Thank you, Michael, for the land acknowledgement and the beautiful music. Welcome to the NAMI Together Again for Mental Health LA Conference. I'm Trowdy Winters, honored to serve as the Executive Director for NAMI Greater LA County. I'm going to get right into our program, one of our keynote speakers, because he's on limited time frame. Dr. Mark Ghaly was appointed Secretary of the California Health and Human Services Agency in early 2019 by Governor Gavin Newsom. In serving California, Dr. Ghaly has the privilege of working with partners across sectors and disciplines to improve the lives and chances of all Californians. This has been especially true during his response to the COVID-19 pandemic. Dr. Ghaly is a primary care pediatrician who continues to use his clinical and community experiences working in California's healthcare safety net system to inform a whole person, whole community approach to integrating services so they are equity anchored and person-centered for all, but especially the most vulnerable Californians. Dr. Ghaly holds the deep belief that together our collective efforts can not only serve Californians well today, but set us on a path where all Californians have a brighter and healthier future. Nothing he does can be done without the support of his wife, Dr. Christina Ghaly, and his 4 children. Please join me in welcoming Dr. Ghaly.
Good morning. It's always fun to hear how the bio is going to be read and whether they include that very last line, which is the absolute most important. Any of you who know myself or my wife know that she makes most things happen in our household. I love to be along for the ride. I do what I can. And even this morning, that's testimony. Many of you may or may not know that I'm an Angeleno, even though I work for the governor in Sacramento. A lot of my roots and teeth were cut here in Los Angeles around a lot of the issues that today I have the privilege of working on. And I will also say, Michael, thank you for your land acknowledgement. Really, really important. As a non-Californian originally, I grew up in the Midwest. Having my kids in the elementary schools here in LA, I've learned a lot about the Tongva and through what they've learned in school, whether it's in grade school, middle school, or high school. I'm really glad that they're learning across this area what the native land is really about, who the native people are. And I think that guides so much of what we do and think about today. So really privileged to be here and part of this conversation that I know many of you coming together for maybe the first time in a long, long time to hang out, talk, hear and think and listen to each other around what we can do differently in the world of mental health and behavioral health. I have had the true privilege of being in this job during this really critical time. And I must say, I can't imagine a secretary or any of us who don't think that this is the critical time, and we should. We should really consider the moment now as a critical time for action and motivation and movement. And when it comes to California's focus on mental health and behavioral health, the governor and I like to talk about a mental health movement, and that we are really not just starting that, I think we're deep into it, but really riding on the coattails of many, many of you who've been on the front lines with your own families, with your communities, around what it's like to experience unmet and undermet needs in the behavioral health space. And I'm very deliberate not just to talk about mental health, but behavioral health, because that intersection between substance use disorders and mental health is so, so key. And I have heard in my years here, whether it's from Mark Gale or others, Mark, great to see you, that you can't really separate some of these things, and treating people, as we talk about, as whole people is the most important thing. And for families, for those here representing a family member here because of a family member, you know that better than anybody. You can't separate the heartache, the misery, the difficulties, the challenges, the ups as well, from the fact that people are whole people. They aren't the head separated from the body. And we in healthcare are finally getting that message and starting to build that into the way we do our work. So I just wanted to talk for a few minutes about a couple of the things that we're doing at the state that I think are so vital to your work. But if you hear nothing else that I say, please hear a big thank you for the work you do, for the loved ones you are here because of, and for your communities to increase our awareness, to reduce the stigma, and to hopefully bend the arc of everyone living with a behavioral health condition towards that stability, success, recovery, and community anchor that I know we all want. So COVID, I've often talked about as both the great unmasker of inequities and disparities, but also the great accelerant for change. And if you look at what California has done in the behavioral health space because of COVID, not just because COVID uncovered everything, but because of the opportunities that we have to invest, to reform, to remodel, to really build this movement that we talk about. Whether it's where we started, frankly, one of the first things we did was invest in the felony IST program at the state level. And I'm sure, I hope very few of you know exactly what that is, but when people who are so sick get caught up in, are charged with a felony and end up spending time in the state hospital, we know that that is because a system upstream failed that person. So how have we invested as a state in those events before somebody ends up in the state hospital? The governor put in $600 million to, in an ongoing way, not just one time. We often sit up at the state and say, oh, look at this big thing we did, and then it's a one-time investment. This is $600 million each and every year to commit to moving upstream of the state hospital system. I know I see Dr. Wong here. She has the great privilege of leading the Department of Mental Health in Los Angeles, taking some of those resources and putting them to good use, building up the kinds of programs that we know are going to be needed if we're ever going to ensure 100%, whether you live in Southern California or Northern California, the coast or the Central Valley, that you're going to have access to the kinds of services you need to avoid the trauma, the dismay, the difficulties of the carceral system. Secondly, on the other end of the spectrum, the governor, right on the heels of COVID, or the major parts of our stay-at-home orders and the real scare before the vaccines were available, put $4.7 billion in a children youth behavioral health initiative. And the purpose of that is to pay attention to the data we know, that more than 50% of severe mental health issues and substance use disorders begin in or before adolescence. So where are we going to make a meaningful investment? How are we going to make sure every kid in California, 0 to 26, no matter which family they're part of, no matter which part of the state they live in, starts to get the kinds of services they need? And this is taking the form of lots more people working on mental health and behavioral health in schools, whether that's early childhood education settings or high schools and even post-secondary colleges, community colleges, tech schools, et cetera, building technology platforms so that all Californians and their caregivers that are 0 to 26 have access to some of these important and vital tools on getting support in through whatever it is, whether it's the new sort of chat bots that are becoming much more available and popular, or whether it's a connection to virtual clinical services, or just some encouragement day in and day out. New tools to support clinicians, whether they're primary care providers or they're in the behavioral health space, with what we call e-consult, consultation from experts who aren't necessarily in the same building or even in the same network, but that are available to you to give advice on how to support your patient, how to support the loved one in front of you, et cetera. And then, of course, this huge investment in workforce. We know, I'm sure many of you have experienced it, where you're able to find someone, but not exactly the right person to serve and support the needs that your loved one has or somebody in your community has. And we are in desperate need of building the behavioral health workforce in California. And that starts, I often say, workforce doesn't grow on trees. Uh, Frankly, if it did, that wouldn't be fast enough either. We are in desperate need of increasing the workforce. The governor and the legislature have put in billions of dollars of investment to make sure that we can build up that workforce. And that workforce isn't just what we expect today, psychiatrists, social workers, caseworkers, really talking about new types of professions like behavioral health coaches or wellness coaches, people who leverage their peer or near peer experiences into professions and jobs that are valued by many, many, many Californians. And we don't want to rest until we're sure that every region in California have access to the workforce that they need. Two last things, and I can go on, and there's so much on our website, CalHHS, uh, California Health and Human Services, of things that through our efforts, but really through the governor's vision and efforts and willingness to put his name on the line for mental health, that we've been able to do. But two really important ones, one that just launched in 7 counties in California, soon to launch here in Los Angeles, is the CARE Act, or the CARE Pathway, as I like to talk about it. And many folks know those with the most severe behavioral health conditions who languish in either institutions or sadly on the streets. They're missing a whole lot of service. They're not just missing access to medications or the ability to get a clinic appointment. They're missing housing. They're missing that wraparound support that frankly was part of the vision of our first version of the Mental Health Services Act. But how do we make sure that we're all held accountable for that part of the population that is often so sick? Lucky to have someone in this room or someone you know supporting them, but oftentimes not, to not just be in the line at all for services, but towards the front of the line. How do we make sure that this is a population that we prioritize? And not just through lip service, like, yes, we're going to try to build all of this, but how do we use a system of accountability to make sure that we deliver those vital services like access to medications, that clinical support, and the housing? We talk about that as a care plan. We're building it out in 7 counties already for just over the last month. We haven't gotten hundreds and hundreds of referrals, and frankly, we didn't want that. We didn't expect it. We expected this program to be available, likely to serve over the next couple of years, 7, maybe 10,000 Californians who are in that most sort of significant, severe category of psychotic disorders, schizophrenia as a prime example. Hopefully, as a way to stop that group of Californians from getting incarcerated, from ending up in hospitals, cycling in and out. The second thing, I will try to take a couple of questions unless that's not part of the program, but I see some hands coming up, and if I can't answer them here, I'm happy to answer them later. The second program that we're really proud of, which is our 988 work. So show of hands, how many people know about the 988 hotline? How many people know someone in California who's used it? Anybody? Okay, fewer hands, but hopefully we see more and more uptake. We're frankly one of the leading states in the nation who've implemented 988, not only on time, but a more rigorous way. Not surprising, the biggest state in the nation also has to date the most calls, but we're actually using the 988 call line as an opportunity to revamp all of our crisis services, to go more mobile, to have more capability within our Medicaid system to bill for additional crisis services that weren't available before. So really trying to create this network so that when someone is in crisis, they don't need to turn to law enforcement. They don't need to turn to only the emergency rooms where the story isn't exactly clear what's going to happen, but that we can hopefully build a cadre of trusted, community anchored crisis services, crisis professionals in all of our communities across California to be able to support individuals at that moment of crisis when we know so many things could go right, could go wrong, and often go wrong, and we want to see those things stop. The last thing I wanted to mention before I wrap up is something that in this work over the last few years, I just wanted to bring to this room and say, uh, as I've spent time in communities, spent time with families, with people, peers, with people in the systems that I have the privilege of helping support their design and redesign, I have noticed that so many of the groups working with us, you all, many, many others, we have so much more in common than we have in difference. And I think about this as later today, I have the privilege of spending time with a small group of people talking about what do the new types of residential treatment services look like in California? How are they bold and different? How do they look at supporting individuals, respecting peers, respecting the experiences of families to bring them together, to focus on the common rather than the difference? And I spend a minute on this, and you may ask, well, why are you bringing that up? Because I have seen the snowball that is building up little by little in California around reforming and making top tier, top notch behavioral health systems stymied occasionally. We push through, but stymied occasionally because we focus on the slight differences. What do families want? What do peers want? What do they want that's different? I urge us all to obviously hold true to what we believe is the right thing to move forward, but to also spend more time listening, spend more time understanding so we can all push through these differences and find the mighty power of our common, why we're all here today. Nobody's here because they don't want to see everyone's loved one get a little bit more, get a little bit better. And I believe that is true of all the groups focused on this. And so even though we're going to have a tug of war between voluntary and involuntary, locked and unlocked, conversations about all of these things that are really, really, really critical for California to struggle with, just like the rest of the nation will, I just urge us to focus on our common more than our difference to be able to push through. So again, I'll end with where I started. If you hear any one thing from me today, it's a deep thank you for doing the work despite the difficulties and the challenges, on behalf of loved ones, on behalf of families, on behalf of communities. It's been a real privilege to walk over the last few years with NAMI California, the various chapters and the leaders that are so heartfelt, so smart, so committed. And so I'm humbled to be here today and just really appreciate a few minutes of your time, and good luck with the rest of the day as we really do make this mental health movement in California a movement for all Californians, regardless of where you are. Thank you.